Welcome to part one of the HIV and opioid use virtual communities of practice. Today's session is on trends, prevention, and treatment options presented by Erin Williams, Senior Director, Training and Technical Assistance at the SAMHSA Center for Integrated Health Solutions. The purpose of these virtual COPs are to provide short, concise, information-dense learning opportunities to staff at MAI-CoC grantee sites. As a disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, Substance Abuse and Mental Health Services Administration, the Health Resource Services Administration, or the U.S. Department of Health and Human Services. This is your faculty today, and he will be presenting on the subsequent two sessions as well. Erin, please take it away.
Thank you. Hello, everybody. As stated earlier, my name is Erin Williams, and I am the Senior Director for Substance Use Training and Technical Assistance with the SAMHSA Center for Integrated Health Solutions. So I'll be your host/moderator for this particular Communities of Practice virtual session. So today we're going to have some discussions about substance use and opiates, and especially its connection with HIV. So we want to start this off by just talking about some baseline kind of information and thinking about HIV risk and substance use. Certainly there is a well-documented nexus between HIV and substance use risk. So when we think about some of the main substances of abuse, let's talk a little bit more about what their connection is. So you think about alcohol. So again, excessive alcohol consumption. Binge drinking can be a significant factor with HIV. It's linked to risky sexual behavior and also can negatively impact people living with HIV. Opioids is a class of drugs typically used to reduce pain. A lot of conversation in the news and across the country around opioids. We'll talk a little bit more in depth about that in just a second. But certainly it does. Abuse of opioids also carries an increased risk associated with HIV. Particularly if people are engaged in behaviors such as sharing needles. So certainly there's a significant connection there. Methamphetamines certainly, again, is another substance that is linked to risky sexual behavior, which then can also increase the risk for HIV. Crack cocaine, another stimulant, which certainly has a connection with trading sex for money, increased risky sexual behavior as well. And also inhalants. This one isn't talked about quite as much, but certainly inhalants also have an increased risk of HIV infection and transmission, mainly due to risky sexual behavior as well. Let's go to the next slide. All right. So when we talk about some of the challenges of preventing HIV in substance-using populations, there are a few. This slide really talks about some of the four major challenges. Many folks who have HIV or are at risk for HIV also have other complex health and social needs. And adding in substance use with that can really sort of be a compounding sort of pressure. There's also a lack of access to the healthcare system. HIV testing involves asking questions of intimate nature, particularly around substance use. And there may be some discomfort both from the providers and clients around asking these questions and really being candid around what is happening as it relates to substance use or risky sexual behavior. Social marginalization and discrimination. Certainly illicit drug use, as we think about it in our society, is viewed far more as a criminal activity than a medical issue. That's still true in our society, although there have been lots of changes and movement around this issue in recent years. That's still very much an issue. And those kinds of considerations can discourage people from coming forward and being tested and really having, again, candid conversations about this. We think about also with challenges to adherence to HIV treatment. So people living with with the HIV certainly have complex medical needs and may be taking a number of prescriptions or medications and have to take them on a very regular basis. Using substances can interfere with a person's ability to take their medications as prescribed and also certain side effects to address those. So certainly, again, using substances as it connects to HIV, using substances have a significant negative effect when we think about your risk for HIV. All right, so let's talk a little bit about opioid use trends. Again, really want to get into this, as I think many of you know, the president last year declared a public health emergency around opiate use in this country. So certainly we have a significant problem there. Here are some of the latest data from SAMHSA, talking about sort of where we are in terms of opiate use. So we have about 11.8 million people that are quote unquote misusing opiates. So about 4.5 or 4.4% of the population who are engaged in some sort of opiate misuse. About 1 million or so of those are using heroin. About 641,000 of those are misusing both, are using heroin and misusing prescription pain relievers. If you dig a little deeper into the numbers, about 6.9 million people are engaged in some sort of misuse of hydrocodone. 3.9 million are engaged in a misuse of some sort of oxycodone. And another 228,000, people are engaged in some misuse of the drug fentanyl, which is a powerful medication that is implicated in a number of the overdose deaths that you're seeing across the country. So just put these numbers in a bit of perspective when we look at some of the data from the CDC and kind of where we are. So in 2016, the number of overdose deaths involving opioids was 5 times higher than it was in 1999. Since 2000, we've seen more than 600 people die across the country from drug overdose. On average, about 115 Americans die every day from an opioid overdose, a significant public health problem, as was stated earlier. So when we think about these numbers right now, drug overdoses are killing about 64,000 people in the United States per year. That was the last data set that we looked at was 2016. And it is, again, a rise of more than 22% over the previous year, where we were at 52,000 people. So when we look at, dig deeper and look at heroin use, you can see similar trends here in terms of youth use and deaths. So since 2015, you have a 230% increase, of heroin users, and a 630% increase in heroin deaths since 2002. So there are significant numbers in terms of increase of users and also increased risk of death. So, given all of these stats and given the fact that we have a significant problem here, and given the fact that we are, that certainly opioid use and drug abuse in general is significantly tied or linked to HIV and HIV risk, what are we going to do about this? How has, how have we responded at a national level to try to address these things? What are some of the tools that are now available for organizations, counties, municipalities to really address these things? So let's take a look at what the CDC has done already. Certainly the CDC is moving towards engaging in other kinds of activities and other kinds of protocols. But right now, these are some of the efforts that are already underway by the CDC in their national response to substance use and HIV risk. So they support intervention programs that deliver services to people who inject drugs. Again, we know that folks who are injecting substances are at really increased risk for HIV and Hep C transmission. So I also support responses for outbreaks of HIV that are traced to drug use. So they're doing a significant amount of monitoring and working in concert with state health departments to really begin to rapidly respond when state health departments and others show through their data spikes in HIV or increase in HIV risk in certain areas, and really mobilizing to address that, particularly if it's around the issue of injection drug use. They support programs to develop biomedical approaches to HIV prevention for people who use substances. So again, they're engaged really in helping build the research base and literature to find more more treatments and more approaches for people who are using substances and maybe at risk of HIV. They are engaged in some of their more standard practices, which is the National HIV Surveillance System. They also are looking at National HIV Behavioral Health Surveillance Survey. We're expanding that and getting that information in real time around behavioral health and HIV. They also are looking at and helping organizations and municipalities provide more culturally competent prevention messages. Really reaching out to underserved communities to try to provide messages that might be helpful as organizations and cities try to really address this risk. And again, they clearly are working very closely with the White House, other partners, HRSA, SAMHSA, others, in which they are looking to collaborate on this particular issue. All right, so if we continue to dive a little bit deeper here, what has the federal response been, in terms to opiates, given that response to sort of the nexus between HIV and opioid use? There's also been a more direct response to the opiate crisis, and a few things that have happened, and recommendations that the CDC has for states. Really looking at addressing the strongest risk factors for heroin use, which is addiction to prescription drugs, currently. Increasing access to MAT, expanding access and training for folks who are administering Naloxone, which is a anti-overdose medication, which we'll talk about in a second. Also ensuring that people have access to integrated prevention and behavioral health and primary care services. So including access to sterile and injection equipment, as allowed in terms of people's local policies. Also working with local jurisdictions to put these effective practices to work. So helping in terms of working with organizations and counties and states to really put these things into practice, providing that level of technical assistance. So at a more grassroots level, what can providers begin to do to address some of this? Well, one of the biggest things they can do is actually begin screening for substance use, particularly in primary care settings or in HIV settings, HIV clinics and other settings where people may be at risk or may have a high likelihood of using substances. Really, wherever you are in terms of these clinics, if you have folks coming in who may be at risk, you really want to make sure that you are screening and really taking a look at what their substance use habits are, but their habits around substance use. So one of the best frameworks to engage in that is SBIRT, so screening, brief intervention, and referral to treatment. It's a really comprehensive approach that allows you to use a evidence-based screen, provide some brief level of intervention for that concern around substance use, and then potentially, if necessary, refer to more to more advanced services and referral to treatment process. So again, when we think about SBIRT, again, it really provides an opportunity for prevention and early intervention. So to really intervene with people who are using substances before things become really dire. So it's a way to work kind of upstream to engage in preventing more serious consequences of substance use. And these screening tools and protocols, SBIRT itself, can be implemented in a ton of different areas. So not just primary care settings, but in mental health settings, emergency departments, schools, STD clinics, other places. So again, going back to what I said earlier, here is a conversation about making sure if you're going to do, provide SBIRT, provide screening for substance use, that you're using an evidence-based screen. There are a ton of evidence-based screens out there. You do not have to reinvent the wheel. You can easily do an internet search and find a number of them that may work for you. This list here is really just a small subset of screens that you can use. The audit is certainly a very good screen for excessive alcohol use. The DAST is a similar screen for substances, drugs of abuse. The assist is a bit of a combination because it asks questions about drugs, alcohol, and of course tobacco. The CRAFT and the S2BI are two very good evidence-based adolescent screens. If you have people who are under the age of 18 who may be moving, who may be moving, who may under 18 who may be using substances. Excuse me. The PHQ-9 is a screening tool for depression, which again certainly is implicated in some of these issues. The tweak in the TACE is a tool that really is designed to work with women who are pregnant or looking to get pregnant. The opioid risk assessment tool certainly is another tool that can be used to certainly screen for opiate use. So the other thing you can do in terms of prevention and prevention is essentially prevent overdose. So one of the biggest issues related to the opioid epidemic is the risk of overdose. As we talked about in some of the data earlier, a lot of the opiates that are now on the street and available are either laced with fentanyl or some sort of synthetic similar to fentanyl, and have a very high risk of overdose potential. And the only way you can really get people into services and help them who may be at risk for HIV and other illnesses is essentially to keep them alive long enough to receive those services. And one of the best tools to do that is naloxone. So really thinking about how many people in your organization or how many people at the grassroots level can be trained to use this medication. It is very simple to administer. There are lots of examples across the country where people have used this particular medication to save people's lives. And again, looking at ways to then begin connecting them to treatment and other sorts of resources. So another approach to this, again, is the use of medications for the treatment of addiction. There's a lot of good evidence, which I'll go through in just a second. But when you think about opioids, there are a number of different medications that are there and available. Methadone is certainly one that is used in opioid treatment programs. Buprenorphine, there's several different variations of buprenorphine. Naltrexone, especially the long-acting injectable version of it. So there are a number of medications that are very helpful medications in substance use treatment that could benefit certain client populations, and so getting access to that will be critical. So again, there is a lot of good evidence for these particular medications. There's a lot of evidence there, and I'll leave this slide here to just talk about sort of how these medications are administered and who can prescribe or dispense them. There's a lot of evidence that talks about, particularly around HIV and hepatitis C, that the medications can be very helpful in reducing that risk and really helping patients move forward. Pregnant women, again, there's a lot of evidence there around the benefits of using that both for the mother and for the fetus. So there are a number of resources that are available for substance use and substance use treatment. What we did here really was cover some basic data and then also talk a little bit about what's happening with the federal response and then what you can do to really engage your clients and others in ways that may help either prevent, intervene early or treat, substance use, particularly opioid use, risk, again, because it has a significant connection to HIV and HIV risk. So here now what you're looking at now is a number of selected resources that are available to you. Certainly Health and Human Services has a number of resources. There are lots of information out there about naloxone, overdose medication, a number of different things around pain management and the use of opioids, there to address pain. Certainly the CDC has a number of resources, as we talked about, SAMHSA is a very helpful organization, particularly as it relates to finding treatment resources in your community. The National Institute of Drug Abuse, which is actually the chief research arm of the federal government around substance use and addiction, has a number of different resources as well. Again, here are a couple others here, some toolkits and others that may be helpful as you begin to move forward around this process. So here again, some prevention toolkits and others. All right, so those resources really are some very good resources that I would recommend that you look through and you use and that you engage in order to move forward with your particular programs or protocols. So here are just some citations from the work that I presented here earlier. And if you would like to get a recording of these slides, they can be available on our CIHS website. Here is the link. Certainly our website has a wealth of information around integration of behavioral health and primary care. And you can go there for that and email us if you have any questions. Here's my contact info, so if you have questions there. But thank you, and hopefully you will find these resources useful as you begin to move forward with your HIV and substance use prevention and treatment activities. Thank you.